I got cystic fibrosis. See, I've got cystic fibrosis.
What's going on, guys? Welcome back to Staying Salty, brand new season. This first week, you guys have probably already seen, but we are talking about ORKAMBI and beyond. So what does that mean? Well, in this video, I'm going to tell you guys what ORKAMBI is, how it affects the CF community, what my experience is with it, and then what I'm excited about for upcoming medications or drugs made by Vertex. So, ORKAMBI for CF is a gene corrector drug. So the first drug that came out for gene correctors in the CF community is Kalydeco. And Kalydeco got great results. And I still hear people say like how great it is, how they've been on it, how their lung function has increased. They feel so much better, more energetic, all this type of stuff. And the only issue with Kalydeco, which isn't an issue, but what it didn't bring to the table was it did not target the most popular gene mutations in the CF community. So the most popular that the majority of the CF community has is 2 delta F508 gene mutations. So double delta F508. So ORKAMBI was huge because it was the first gene corrector drug that came out for the majority of the CF community. And, you know, we were hoping for the same results as Kalydeco. We were hoping everyone's lung function increased. You feel better, you breathe better, less CF exacerbations, meaning less infections, less time in the hospital, all that kind of jazz. And in my experience and opinion, it fell majorly short. So I was actually in the clinical trial when I was living in Florida. I was in the clinical trial for ORKAMBI, and I think I was in that for I guess that was only a year, maybe less, but I was in the trial and my lung function did increase from like 42 or 41% to 44. So, maybe it was ORKAMBI, maybe it wasn't, I'm not really sure. But I do know, and I do remember still to this day, I have issues with the side effects of ORKAMBI. So the big one with ORKAMBI, what a lot of people complain about, is the side effects where, you're going to feel short of breath, you're going to feel a lot of chest tightness, a lot of heaviness in your chest, and some people have complained so much that they just aren't taking it. So, this is a huge drug for the CF community, and yet, like, the side effects are so bad that some patients cannot take it. So that's a big deal. I know the drug is supposed to help with lung function. It's supposed to keep you out of the hospital. It's supposed to help with sinuses. And yeah, so in my experience, starting off, it sucked. Like, I felt sick because I felt like I couldn't take a deep enough breath. My chest always hurt, felt heavy. My lung function, like I said, a couple of percentage points that went up, but I was I'm big into working out and stuff like that. So I don't really know if it was the fact that I had just moved to Florida, a new environment, better air quality maybe, with the, salty air. I was working out a lot, putting on a lot of weight at the time. So there were several factors that I don't think I would necessarily contribute that lung function increase to ORKAMBI. But one thing I did see that I think helped is a lot less sinus issues. So ORKAMBI really seemed to have better results in me as far as sinuses. I didn't have as many sinus infections. I've had 7 sinus surgeries, so my sinuses are just crap. But I did feel less pain, less inflammation, stuff like that. But yeah, I complained to the doctor several times. I just didn't feel like it was doing anything for me, that the side effects weren't worth it. Because the side effects, guys, they do subside. So if you guys haven't taken it yet, or you have, and you can probably relate to me, but for the first month or two, those side effects were pretty strong. Like the shortness of breath, just feel really inflamed and tight. And that did start to go away. However, I have a solution for you guys. So there's been times in the past 2, maybe 3 years now that I've been taking ORKAMBI that I have been without for like a couple weeks or a month or whatever. And when I try to start back on it, I get the side effects right away again. So what I have seen or what I've experienced helps tons, guys. If you guys are going to start ORKAMBI, or you guys stop taking it for a while and you're going to start back on it, is lower the dosage. So take, like right now, you take 2 pills twice a day for ORKAMBI, right? Lower the dose, take 1 pill once a day. Do that for a few days. Then ramp up to 2 pills once a day. Or maybe 1 pill twice a day, so 1 in the morning and 1 at night. Then, do that for another few days, maybe a week. And then ramp up to adding 1 more pill, repeat, and then eventually you're going to do that 2 pills 2 times a day. But that gets your body adjusted to the drug. The side effects aren't as harsh, and you kind of build up tolerance, and it works fine. But anyway, that's enough about ORKAMBI. That's what the drug is. That's the side effects that come with it. It's a gene corrector drug for the CF community. It's a huge deal because it was the first gene corrector to target the majority of what CF patients have, which obviously, including me, I'm on it. But now we have Symdeko. So I don't know who comes up with these names for these drugs. It's freaking crazy. But Symdeko, Symdeko, might be CKO, but I think it's KO. But Symdeko. So Symdeko is another gene corrector. It is huge. So it's apparently, so this is what I've been told, it's ORKAMBI without the side effects. But I have heard from patients that it's been great. So I think Chad might even be taking it if you guys watch his video. But a lot of patients have seen like really good results. They feel better. They have more energy, less shortness of breath, and overall lung function increases, stuff like that. And the problem with ORKAMBI, when I complain to the doctors, they're like, well, you need to keep taking it because, it's preventing CF exacerbations. It's preventing you from going to the hospital. And I don't know, that could be true. I just feel like that's a cop-out because you're not seeing or feeling any results, and you're not going to the hospital, but like you're going to contribute that to this drug, and this drug, you're not seeing any other results. Does that make sense? So like, I could just be staying out of the hospital because I'm taking care of myself, but yet they're going to say, oh no, it's that drug, it's that drug. So that drove me nuts. So I'm excited that Symdeko actually is supposed to do the same stuff. It's supposed to lung function increases, supposed to prevent the progression of the disease, keep you out of the hospital, less CF exacerbations, help with sinuses, and could be even some more stuff, but help with weight gain as well. So that's another thing ORKAMBI is supposed to do. So anyway, so I'm excited because I've heard a lot of great things. I've heard less side effects. I've heard actually lung function increases, weight gain, just energy levels are increasing so much more. Patients that I have heard lost hope, that they were like, oh, always depressed, or like felt bad about their health. They're actually having hope now. They're starting to get excited. So that's awesome. So the only reason I'm not on it right now is because you guys might know from my Instagram, at Defy to Breathe, but you guys might know from my Instagram, I just started a new job, and my insurance sucks, by the way. So I had United Healthcare with my previous job, and United Healthcare has prevented Symdeko approval for the first 6 months. So apparently this is a common thing that insurance companies do. Not all insurance companies, but they will, if a new drug comes to the market, even if it's FDA approved, they will actually hold off on benefit coverage for the first 6 months or maybe even a year. I don't really know why. I don't know the specifics, I don't know the details, but it sounds like a load of crap. But anyway, so, submitted my insurance. They won't cover for the first 6 months, which really sucks. But luckily, like I said, I did get a new job recently. As of 2-3 weeks ago. My new insurance kicks in April 1st, only a week or two away, and I'm going to resubmit to my new insurance company, which luckily is not United Healthcare, and hopefully, fingers crossed, that they will cover it, and I will be able to get Symdeko and try this bad boy out. Anyway, guys, that's it for this video. The only other thing I want to mention is it is super exciting, the stuff that's come out for CF. So if you guys are young with CF, if you're a parent that has a CF child, or you guys are older with CF, but like, think about this, guys. Like, this is huge that these drugs are coming out. You know, we started with Kalydeco. Kalydeco is great. ORKAMBI, I feel like, fell short. We now have Symdeko. There is more drugs coming to the market in the next year or two, and there's going to be a huge one. So I had a presentation where I went to Kansas City, Missouri, and I talked, and they were doing a lot of science talk and presentations and whatnot, and there's a huge drug coming out in 2019 or maybe 2020, but it's a triple combo drug. So in the presentation, they mentioned that this triple combo drug is supposed to correct the CF gene. So remember, the CF gene is a defective gene. It's supposed to correct the gene by 80%. So obviously, we don't know. The idea behind CF and curing this disease or whatever is, let's correct that defective gene. We don't know to what extent we have to correct it. Do we have to correct it by 100% in order to see like the best results? Do we have to correct it by 50%? So just one of those things that we don't know. But point being is, it corrects by 80%, and it's supposed to be pretty huge. So that's really freaking awesome, guys. This is one thing. I've always been skeptical about cures for diseases, and, you know, if there's a cure, how much money is going to be lost for pharmaceuticals and doctors and all this kind of crap. So I'm kind of one of those, like, I think there might be a cure out there, and it's just not really being revealed, or it never will actually get revealed. So I think it's ironic that they come out with these drugs that, like, maintain or prevent the progression of diseases, but you have to keep continuing to take these drugs. But anyway, that's besides the point. But the point being is, it's super cool. Like, this is one disease that I'm obviously really familiar with that actually feels like we're making a lot of progress, and one day here soon, soon as in the next, you know, 1 to 5, 10 years, we actually might have somewhat of a cure, right? We might actually have a medication that's going to stop the disease in its tracks. And you might have to keep taking the medication every day for the rest of your life, but at least it's not like CF has been, right? At least it's going to take away the symptoms. It's going to give us better quality of life, give us the ability to live a normal life without the stress and worry and sickness and all that kind of stuff. So, super excited, as you guys can probably tell. Hope you guys are excited. Hope you guys stay positive. Remember, guys, these drugs are awesome. They are coming out. But if you do not take care of yourself, if you do not get a positive mindset, you are not going to be in the best shape or even make it to see those drugs. You have to be in the best shape. You know, if you think about starting a drug 5 years from now, that's going to stop the progression of your disease. That doesn't mean you can let up right now and get worse over the next 5 years. Would you rather stop the progression of the disease if you have like 50 or 60% lung function? Or would you rather just let yourself decline because you know this drug's going to come out, and then you're going to stop your progression of the disease at 20 or 30% lung function? So, it's all I want you guys to keep in mind is, even though these drugs are coming out, you have to take care of yourself, be on top of it, and be excited. Alright, guys, I will see you guys next week. Next week, hold on, I can tell you guys if my computer loads fast enough. Okay, it's not loading fast enough. I'll see you guys next week, and yeah, we're gonna have a good week. Alright, hashtag stay salty, guys.
See, I've got cystic fibrosis.